I'm Namrata Kulshreshtha. So I will be presenting my views on indoor air quality and clean air for spaces, basically combining indoor air quality as a health, well-being, and productivity priority. So previous speakers has already said many things about it, and I think my views also aligns with them. So first of all, I would like to start with why indoor air quality matters. So first of all, when air quality comes in someone's mind, so we think about the ambient air pollution, like what is PM 2.5 value, what is PM 10 concentration in outdoor air. But most of the people didn't think about the indoor air quality, which matters a lot because we spend most of the time, 80 to 90% of our time indoors. And whether it is in offices, whether children in schools, whether it is hospitals or some business establishments or some commercial facilities. So most of the time we live indoors, and so that becomes very essential part of our life because we are exposed to indoor air quality. And as there is a limited air exchange in indoor environments, the pollutants concentrate in that particular environment, which impacts our health and leads to certain respiratory diseases, cardiovascular diseases, and neurological harms. And also in terms of business or in terms of organizational thing, we used to see that bad air quality also drives absenteeism and also higher healthcare cost of an individual. And we also see that the organization see less loss of productivity in terms of indoor air quality. So most of the pollutants which are involved in indoor air quality and are of prominent in nature are PM 2.5, VOCs, NO2, ozone, and some biological contaminants. And the thing now arises how poor indoor air harms us and what is the human toll of that indoor air quality on us. So researchers and studies, WHO and most of the researchers have found that roughly 1 in 5 deaths worldwide is linked to air pollution, whether it is associated with indoor or as well as outdoor. And also WHO links that around 3.8 million premature deaths in a year to household and indoor air pollution. So that is a way big amount in terms of our population and premature deaths. And also it is associated with the poorly ventilated offices, where we have seen that around 50% of sick leave was um, taken by the employees due to poor indoor air quality. So we have seen from these data that well ventilated air or well ventilated air environments are really important, which can double your productivity, double an occupant's cognitive test performance. So in this data, I would also like to include one thing which I have found in last 1 or 2 years. So that there was a landmark historic case of London, UK, where this was the first case where a girl or 9-year-old Ella, her death was considered as a cause of air pollution. So that is a mind-boggling thing, I think, and that's why it is very important to understand indoor air also and outdoor air also. So I would like to highlight some sector spotlight on hospitals and schools because most of the people in hospitals and school settings are vulnerable populations. So in case of hospitals, we see that there are varied pollutant sources, not just particulates, and the staffs and patients face headaches and respiratory system. And the dilemma is that we cannot assume and we cannot predict whether that respiratory system or that headache is due to indoor air quality or due to some other reason. So that's a dilemma in these cases. And also HVAC design, filtration, and maintenance. So that's why it is important to understand the designing of HVAC, filtration, and maintenance to protect these occupants. And also in terms of schools and childcare settings, we see that children breathe faster and spend long hours indoors in the schools and daycare facilities also. So they are highly susceptible to these indoor air pollutants. So that's why it is important to have the ventilation and proper filtration and monitoring that indoor air quality. So again, in terms of office environments, I have seen the study from Saint Cobain and GBCI India. So we have seen that only 25% of offices showed CO2 below the safe limits, so which is a clear sign of inadequate and adequate fresh air. And only 67% of offices had excess NO2 indoors, but only 10% are measuring it and had the system to remove it from their office environments. So I would suggest, as other panelists also suggest the similar things. So add to that, I want to suggest there could be 5 levers for clean indoor air. The first one is ventilation, filtration, humidity monitoring, and source control. So in terms of ventilation, I would like to suggest that flushing CO2, VOCs, and other pollutants with fresh air. And it is very important to keep carbon dioxide within 1000 ppm, and also demand controls and looking into the occupancy uh, of that specific indoor environment is very important. And also because modest CO2 in even a modest CO2 rise in CO2 uh, shows a lower cognitive scores and lower test performance. So that's why fresh air is important and indoor air quality matters a lot. And in terms of filtration, if we see MERV 13 or HEPA filters traps PM 2.5 dust and allergens, which are also vital in polluted cities. So that's why better filtration and also ventilation is important, which is links to fewer sick days and also increase a person's productivity and increase the economic value of organization also. And in terms of humidity, if we see that we have to hold 40 to 60% of relative humidity, which is a sweet spot between comfort and respiratory defense, because a too dry air irritates our airways and prolongs virus survival. But contrary to that, too humid feeds mold and dust mites. So that's why it is very important to hold relative humidity to 40 to 60 or 70%. And in terms of 4 and 5 lever, that is monitoring and controls and source control, it's very important to monitor continuously, not just for a small time, but it is very important to monitor indoor air quality with the specific sensors, so that here you can also use AI driven technologies and also automate your system where you can link your sensors to HVAC, so that a little rise in CO2 can boost the fresh air or increase the air filtration rate, and a high PM 2.5 can ramp up the filtration of the system. So that's why it is important to have a monitoring as well as some automation or AI driven technologies over here. And also, so in source control and design, we see that we have to, as other panelists also suggest, that we have to look into our designing systems also. We already have a green building council for that, and they already suggested that you have to look for the low VOC materials, and good design can beat the pollution later. So that's why it is important to cut the emission at the root level. And this is important not only for indoor air quality, but it is also important as for outdoor air, ambient air quality also. Because if you reduce the mitigate the pollution sources of outdoor ambient air, so that you can also improvise your indoor air quality. So that's why it is important. And you can also swap high emission sources, like we have seen that in commercial establishments we have kitchens in cafeteria, so you can also switch to inductions, so that you can remove you can mitigate the emissions from there. So centralized layered controls can outperform the standalone purifiers in most of the situations. And combining all these 5 levers is important to have a better indoor air quality. So now for India, in terms of regulatory framework, we have seen that we have some regulations or we have some advisories for indoor air quality, but there are not such specific authority for who is looking into the indoor air quality things. Like we have ANCAP 2019, we have which only looks into the outdoor ambient air quality thing, and but we have national building code, we have ventilation advisories, we have green building standards. But again, there is no strict uh, strict permissible limits like ambient air quality, which so that we can monitor indoor air quality as well. So there are some myths and hidden realities in indoor air qualities. The first one would be the AC trap, split AC trap, because the split AC always recirculate the indoor air without incorporating the fresh air intake. So that's why it is important to look into that parameter. Also, CO2, because indoor, as I have said earlier, also indoor CO2 often reaches this much of amount, and it can reduce your cognitive performance by up to 50%. So, and also ventilation alone backfires. You have to include ventilation with filtration also. And an ungoverned blind spot is our outdoor air is regulated, as I have said earlier in the previous slide, and indoor air is not. So we have to look for a path in which we will have a single authority which will handle indoor air quality. So there are some examples in India also, which are looking into the clean air engineering practice. So these are the common clean air technologies which they have looked. These practical examples of just Lok Hospital, and they have looked into these common clean air technologies. And there is a proof from them that in Gurgaon office there is a HVAC optimization plus filtration which upgrades PM 2.5 by 6-fold, and there is a VOC reduction, around 70% of VOC reduction in a pharma unit. And also there are smart offices which are using multi-parameter sensors and dashboards, and almost greater than 90% of indoor air quality compliance was achieved. So there, as I have said earlier, there is a regulatory gray zone. So we have regulations, we have advisories, but we don't have a specific authority which, and so that we cannot legally enforceable Indian air qualities, indoor air quality standards for specific commercial buildings or business establishments. So here I have suggested an IAQ benchmarking matrix. And in terms of that, if you see in terms of these parameters, you see we are here as India, and in compares to global benchmark, global matrices, I have figured out that we are not aligned with these. In most of the things, there are major gap, and we need to think about it. So there can be a roadmap for India indoor air quality improvements. In short term, we can think about to develop a national indoor air quality code. We can adopt WHO aligned pollutant limits, and also in terms of medium term, we can say that we can mandate continuous indoor air quality monitoring, and also we can have IAQ certification, just like green building certifications and compliance audits also. And we can also regulate low emission materials and products. And in long term, I will be looking forward to have a national indoor air quality authority, and which can implement sector specific enforceable standards, and which will integrate digital IAQ dashboards with building codes. So here are 5 things, 5 key takeaways to carry forward from my presentations. So we have to shape indoor air quality, health, and performance, and we have to protect our vulnerable occupants, vulnerable populations like children and patients, and also workers of business establishments. And so 5 levers can be ventilation, filtration, humidity monitoring, and source control, depending on the occupancy also. And we have to shift our snapshot compliance to the continuous monitoring, exposure to the health risk assessment, and performance based management. And we have to close the policy gap also, because India needs an enforceable indoor standards which need to be mapped to outdoor ambient air quality also. So yeah, thank you.